Rồi trước khi mà mình bắt đầu á, thì giống như nãy mình có nói với anh Minh đó là xin một cái disclaimer là thật sự là lựa từ cho Pediatrics để mà dạy trong 1-2 tiếng đồng hồ thì thật sự là rất là khó, nên là mấy bạn nhìn cái handout thực ra là có rất là nhiều từ. Nhưng mà cái điểm đặc biệt của bên nhi hay là bên pediatric đó thì thường là những cái từ nó không có quá chuyên ngành, nó là những cái từ mà ngay cả bệnh nhân bình thường người ta cũng sẽ sử dụng, nên là hy vọng là nó sẽ không có quá khó hay quá phức tạp. Mình cố tình chia ra theo mỗi cái từ vựng được vô từng cái nhóm tuổi, thì ví dụ như là bạn nào mà cần khám chữa bệnh cho mấy em mà sơ sinh đó thì có thể học cái phần sơ sinh, còn bạn nào mà khám chữa bệnh cho trẻ lớn hơn thì học cái phần của trẻ em lớn hơn, thì tùy theo nhu cầu của mỗi người lựa từ mà học ha. Rồi thì nếu mà mình bắt đầu thì mình chuyển qua nói tiếng Anh, nếu mà có cái vấn đề gì không hiểu thì hỏi rồi mình sử dụng tiếng Việt ha. Alright.
Okay.
So let's get the first one to pronounce this word.
Một, Bùi Hương Ngọc số 6 chuẩn bị.
Right. So number 1.
Pediatrician.
Right. So pediatrician. So the stress is on here.
Yes.
Right.
Pediatrician.
Yep, that's a little bit better. Excellent. Alrighty.
Yes.
So it just means that it's the physicians who take care of children, right? I really love this definitions of my job. For those of you can understand it. Alrighty. Next set. All right. So pediatrician is a little bit unique, that we kind of take care of quite a wide range of different age group, and each age group have their own kind of characteristics and diseases associated with it. So it's important for us to kind of know what age group we are dealing with. So this is the common age group that you will see in pediatric. So I'll get, so there's 6 terms here. So each of you can try 2, and then the last one can do the last 3. Does that sound good? All right, so number 6, I believe is next. Minh Tùng.
Yes, it's newborn, neonate.
All right, that's great.
Yes.
And then next term.
This is the infant.
Infant. So just be careful, like you when you pronounce it, it sounds like there's just a little bit of like curling of your tongue, so it sounds like there's an R sound somewhere in here. So it's infant. Yep, that's a little bit better. Excellent. All right. So newborn or neonate has the same meaning. So it's babies from 0 to 1 month, and then infant is from 1 month to 12 months. All right. I'll get the next one. Number 7, Nga Đổ. You can pronounce the next 2 for me.
The next one is toddler. That's number. And school age child.
School age child.
School age child.
Yep. All right. So yeah. So toddler is from 1 to 4, and then school age child is like usually like primary school age in Vietnam. All right. And then next one is number 10, Minh Trang. Trang, can you unmute and read the next? Just to save time, I'm just going to move on to the next number, and then we'll try to come back to you in a little bit, okay? Number 11, Phước Đông.
Yes, I'm here. Adolescent.
Yep, so
adolescent. Yeah.
Okay, that's great. And then how about this word?
Yeah, adolescents. That's describe the people who is young and the young people. Yes.
Mm-hmm. Yep. So adolescent include kind of two age groups. So can you pronounce this word for me?
Teenager.
Teenagers. Excellent. How about this?
Young adult.
Excellent. Perfect.
Thank you.
Alrighty. Yep. You guys are doing great. All right. So now that we kind of know the age group, we can kind of go into each of the age group. So we're gonna start out from the smallest of the age group. All right, number 12, Thanh Nam.
I'm here.
All right, so can you pronounce this word for me?
Fetus.
So fetus.
Fetus.
Yep, fetus. So the T in here, it sounds a little bit like a D. So fetus.
Fetus.
All right. So you know what fetus is? What's the meaning of fetus?
Gestational age.
Right. So before we move on to the next word, do you know what is the meaning of fetus? Bạn có biết nghĩa của chữ fetus là gì không? Right. Thanh Nam.
Kiểu mình biết nó là kiểu là thai nhi.
Yes. So yep. In Vietnamese, thai nhi. The definition in English is an unborn human baby, right? So before the baby is born, we call them fetus. All right. And let's move on to number 14. Hoàng Lan, can you pronounce this word for me?
Fetus.
Excellent. How about this one?
Gestational age.
Yep, gestational age. Excellent. Can you define gestational age for me?
It means the age of a newborn.
Yep. So it's actually the age of the fetus, right? So it's how long the fetus has been inside the womb. So usually a normal pregnancy is about 40 weeks. Baby can go through a different stage of development. So we age them using gestational age, right? Okay. Này trong tiếng Việt gọi là tuổi thai á. All right. Hopefully there's no questions. We can move on to the next word. Okay. All right. Number 15, Ngọc Ánh. So this is a little bit tricky. If you guys don't know, that's fine too. What is the difference between these two babies?
The first baby is enough age, and the second baby is not enough age after delivery.
Excellent, right? So this baby is kind of like born at the correct age, right? And then this one on the right is like too early, right?
Yeah.
So do you know the term for those? Like how do we call a baby who born at the correct age?
Mature.
Mm-hmm.
No. I just say about the newborn not enough. Enough age is premature.
Excellent, right? So born too young is baby's premature baby, right? So the tricky part is that unfortunately the one who born at the correct age, we usually don't say mature baby because it just sounds kind of a little bit awkward. So we call them full term infant. So full term, it means that it goes to the end of the pregnancy. Does that make sense?
Yes, full term baby.
Yep, excellent. Full term baby, premature baby.
Yep.
All right, and then usually like in the NICU we call them with kind of like acute names. We call them preemie. kind of like it's short form for premature infants. All right, next one, number 18, công trung. Can you tell me what is the name of this structure?
Umbilical.
All right, so you are very close. So umbilical is around here, right? So the umbilicus is, or belly button is right there. So this is what we call an umbilical cord, right? So it looked like a cord. So we call them umbilical. So let's move to the screen. All right, so this is kind of a little bit of a summarize of what we just see. Thanh Loan, can you read the first 3 terms for me?
Term fetus.
Fetus, excellent.
Gestation.
Excellent.
Gestational age.
Perfect, thank you. All right, and next one is Thanh Tú. All right, Tú, can you read the next 4 terms for me? Tú, can you hear us? Please unmute and read the next 4. Okay, we're just gonna move on to number 25, Nhung Lê.
Yes, I'm here.
Excellent. All right. Yep.
Yeah. Term newborn.
Excellent.
Preterm. Premature.
Right. So mature.
Mature. Premature.
Excellent.
Premature.
Yep. So the stress is on the last syllable. Okay. Oops. Sorry.
Sure. Yes.
Excellent. All right. Next term.
Vaginal delivery.
All right. So the stress is on the first syllable, right? So vaginal delivery.
Vaginal delivery. Vaginal delivery.
All right. Yep. Excellent. And then how about this?
Cesarean section.
All right. So we yep. So I actually did I include the pronunciation down here because this term is kind of a little bit tricky. So it's cesarean section.
Cesarean section. Cesarean section.
Excellent.
It's a surgical operation for delivering a child. Là mổ lấy thai ạ.
Yep. And then so when like normally when we talking between physician, we usually don't say the whole term. Yep, we just say C-section. So most people understand that term. Excellent. All right, thank you very much. We're gonna move on to Nam Anh, number 29.
Yes.
All right, can you read the last 3 terms for me?
Umbilical cord. Venous.
So,
Venous.
all right. Hold on 1 second. So umbilical cord. So there's a D here.
Umbilical cord.
Right. So so right now you sound more like cost, like C-O-S-T. So it's a cord.
Umbilical cord.
Yep, that's actually a little bit better. Perfect. All right, next term.
Vernix.
Right, vernix.
Vernix.
Excellent. All right.
Meconium.
Yep, meconium. Excellent. All right. Do you know what vernix is?
Yes. In Vietnam, that means chất gây.
All right. So you can actually see it kind of on this baby, right? So those little white dish matter on the baby, so that we call them vernix. All right. And then how about meconium?
Not yet.
All right. So who knows what meconium is? You guys can unmute yourself. Yeah. So this term is a little tricky, right? So yep. Go ahead.
I think in Vietnamese it means phân số.
Yep. Excellent. Yep. So can you try to define it in English? It's kind of right there for you guys. So it's the very first stool that the baby passed. What we call meconium. So you will hear this term a lot when you work with like newborn baby, because it's very important for the baby to pass, to be able to pass the meconium. So you will hear that term quite a bit. All right, excellent. Any questions so far? All right, if not, we're gonna move on to number 36, Như Ngọc.
Yes, I'm here.
Excellent. Alrighty. So this is a little bit tricky because for those who doesn't know pediatric, so I'm just gonna let you guys look at the picture and then we're gonna go through the term and then we'll come back to it in a little bit. Can you read the first three term for me?
The first is surgery.
So it's not surgery, right? So look at the term together, right? It's sutures.
Suture.
Excellent, suture, excellent. All right, do you know what suture is?
Em thì nó là cái top ấy, em không biết tiếng Anh nói như nào.
Yeah, so suture is actually not the top. Like the top is like, I think what in Vietnamese is for the fontanelle. So the suture is the adjacent area between the bone of the skull, right? So you can actually sometimes see those on babies. So you see that little line right there?
Yes.
Right there. So those are suture line. It connecting the parietal bone and the frontal bone of the baby. So we call them suture.
Suture.
All right. And then, so the next word?
The next word is fontanelle.
So fontanelle.
Fontanelle.
Excellent. All right. So I think this is what you mean by the top in Vietnamese, is that little soft spot right there in the middle, right? All right. And how about last word?
Last is head molding.
Yep, head molding. So this is a little bit kind of specific. So head molding is when you have the suture kind of sitting on top of each other. It's part of the process for the baby to try to get out the birth canal. Is you have the bone kind of slide on top of each other, and it makes the baby head kind of looking weird. So we call them molding. All right. Thank you. We're gonna move on to the next one. So number 40, bạn Nguyễn Thị Dung. Can you read the next two terms for me?
Cephalo hematoma.
Excellent. All right. So this is kind of a true. This is kind of a true terminology, right? Can you break down the term and kind of tell me what it means?
It means two roots. Cephalo. It means brain. It is containing a brain. Hemer. It is mean blood, and ulmer. It mean ulmer. It mean tumor.
Excellent. All right. So the only thing that a little bit different is cephalo is actually just mean head.
Okay. Cephalo. So it means pooling of blood under a newborn's scalp.
Yep. So it's kind of like the word kind of tell us what it is, right? So ulma is a tumor or a collection of something. So it is a collection of blood on the head. So cephalohematoma. Does that make sense?
Yes. Đây là một cái biểu huyết thanh đúng không cô?
Đúng rồi. Yep.
Cô có mấy bạn ấy bị out ra ấy, bạn ấy nhờ thầy cô cho lại vào lớp ạ. Chị Ngọc Nguyễn ạ, với lại bạn.
Let me see. Anh Minh, can you help? Admin? Everyone. Yep. Thank you.
Em cảm ơn thầy.
Yep. All right. So, and then can you read the next word as well?
Yes, it captures. It is captures pseudonym.
Yep. So this term is quite tricky, right? So it's caput.
Caput.
Yep, caput. Succedaneum.
Succedaneum.
Yep.
Caput.
Caput succedaneum. Perfect. Yep. You are doing great. So because it's such a mouthful, like we usually don't say the whole word. We just usually call them caput. So if you hear caput, this is what it means.
Sorry, I don't hear about that. But
yep.
I also see a lot of newborn. But sorry, I don't think about I don't know about this.
So caput and cephalohematoma is quite can be very easily confused because it kind of looks similar, like a little bit similar, but the caput is just the swelling of the scalp tissue. There's no blood, and the cephalohematoma have blood underneath the scalp. Does that make sense? So one of them is just fluid, the other one is true blood. Does that make sense? Yep. Yeah, that now that you say it, yeah, it's all right. Yep. My Vietnamese term is not the best, so and when you're gonna have to help me with this. Right. Yep. Yep. So I actually include the picture because I know that it's just really hard to describe. So since you deal with baby, you probably know this. So which one is cephalohematoma and which one is caput? Yep. Excellent. Perfect. So like the one upper here, you can actually see the indentations of a finger. So you will not be able to do this with a cephalohematoma. So this is just fluid underneath. This is true bleeding. All right. Perfect. All right. Thank you. And thank you for teaching me Vietnamese term. I learned something new today.
Không biết bạn này không thấy có tên có số không biết là bạn bạn nào. Chắc là để bạn bỏ tên mới biết ai là ai chứ. Không sao, em cứ lo học đi, đừng lo.
All right. And then I think the next one would be number 41, correct?
Okay. Yes. The next one is newborn jaundice.
All right. So jaundice. So it's like it's an E, right? Jaundice. Okay. And then so it's have the same meaning with
hyperbilirubinemia.
All right. So hyperbilirubinemia. So slow down, right? So we can break things down a little bit so it's a little bit easier. So
rubinemia.
Perfect. All right. Yes. Excellent. All right. Can you try the whole thing again?
Yes. Hyper is over. Mia is continuous. And I think it's over pili, nghĩa là tình trạng bệnh tăng cái tình trạng pili, tăng cái huyết thanh bilirubin ở trẻ sơ sinh á.
Yep. The meaning is perfect, right? So anemia is in blood, right? Hyper is too much or over, and then bilirubin is just the name of the substance, right? So hyperbilirubinemia is that you have too much bilirubin in the blood. All right. Can you pronounce the term again for me? Because like you pronounce things separately correctly. I want to be to make sure you can pronounce the whole thing together.
Okay. hyperbilirubinemia.
Excellent. Perfect. All right. And last word.
Next word is cerebral palsy.
All right. Cerebral.
Cerebral.
Yep. Palsy. Yep. Excellent. Palsy.
Palsy.
Yep. All right. Read it again for me.
Cerebral palsy.
Excellent. Perfect.
Yes.
Alrighty. So I kind of break it down a little bit for you guys out here. So cerebral is anything that related to the brain, right? And then palsy mean weakness or unable to move. So can you define cerebral palsy for me?
Cerebral palsy is relates a condition is a weakness of relates to the brain.
Yep. So it's a condition marked by weakness caused by the brain, right? Excellent. All right. Next set. All right. I think we are next one is 44. Nguyễn Thị Ngọc.
I'm here. Breast milk formula.
Excellent. All right. Perfect. All right. So sometimes when we feed the baby formula, we can say that the baby is
breast milk breastfeeding for baby only breastfeeding formula baby feeding bottle feeding.
Yep. So when baby feed formula, we call them bottle feeding, and then when we just use breast milk, or they can actually like feed directly on mom, we call it breastfeeding, right?
Breastfeeding bú mẹ hoàn toàn đấy, bú sữa mẹ.
Yep.
Formula
Excellent.
là ăn sữa công thức.
Perfect. Excellent. All right. Moving on.
Yeah.
All right. And yep. Do you know what's the term for this in English?
This picture winning ăn dặm.
Excellent. It's weaning. Perfect.
Weaning.
All right. And then we call the kind of the first introduction food for baby, we simply call them baby food. Right. It's easy enough.
Yeah.
All right. Excellent. Thank you.
Thank you.
All right. We are now number 46. Nguyễn Thị Thanh Hiền.
I'm here.
All right. Do you know what the whole thing is called?
So what the whole thing is, I don't know.
Yep, it's okay. So all of these graphs you will see for like every baby when they go to see a pediatrician, the first thing we do is we weight them, we measure their height, and then we put them into these charts. So we call them growth chart.
Growth chart.
Yep. So growth is just like seeing like how well you develop, right? And then chart is just because there's a lot of lines and then we plot things into it, right? And then when we start seeing baby who have weight like this, who's kind of like, this is the normal range that baby should fall into. Anyone kind of like hover below the range, we call them failure to thrive.
Yes.
Can you read the
Failure
term
to
for me?
thrive.
Yep.
Failure
to thrive.
Right.
Excellent. All right. Great. We are with number 47, Thị Thanh Thúy. Thanh Thùy.
Failure to thrive.
All right. Can you read the term for me?
Breast milk.
Excellent.
Formula.
Excellent.
Weaning.
Excellent.
Infant reflux.
Yeah. Excellent.
Yeah.
All right. So this is a little bit tricky. Do you know what it is? It's okay if you don't know. It's a little bit kind of more pediatric focus. So we say it as GERD.
Good.
Yep. So it's a acronym for gastroesophageal reflux disease, right? And then how about this one?
Infant colic.
Excellent. Do you know what infant colic is?
Infant colic is sorry, I don't know this word.
Yep. I can explain it in English. I actually don't know the term for the Vietnamese term for this, but this is the prolonged and frequent crying episode in infants, which can be quite normal, but it drives parents crazy. If anyone knows the term, feel free to type the Vietnamese term. Feel free to type it in the chat so that everyone know.
Thưa cô, có phải là cái trường hợp mà em bé cứ khóc suốt mà không giải thích được nguyên nhân trong một thời gian dài, người ta cứ nghĩ là do bị đau ruột, hay là người ta gọi ở Việt Nam gọi là khóc dạ đề, đúng không cô? Em tìm từ nó không có.
Yep. Your description is spot on. Yep.
Gọi là đau ruột, đau đại tràng, cứ khóc thôi, đúng không ạ?
Yep.
Cái đấy hình như là gọi là cái kiểu hội chứng kích thích ruột để phải của trẻ sơ sinh ấy ạ. Nó
không, như thế này là colic là phải như kiểu ruột với đại tràng. Thế nhưng mà bạn ấy cứ, ví dụ có những bạn là cứ khóc 3 tháng, các bạn ấy khóc 1 tháng, đến giờ là khóc và không tìm thấy nguyên nhân khác. Đấy, thế thì có thể là ngày trước thì bảo là thiếu vitamin D, sau đó thì lại bảo là bị đã có thắt ruột. Thì đây là chắc là infant colic, là bệnh của đại tràng, nhưng mà liên tục kéo dài và cứ làm cho em bé khóc suốt.
Yep. Yeah. So the only thing is that most of the time these babies are absolutely healthy. So like there's no disease, they just cry for no reason. So that's usually the yep. Excellent. All right. I learned a new term. Thank you guys. And the last two term, how about number 48, Thùy Trang?
The last two words is grow chart and failure to thrive.
So failure to thrive.
Failure to thrive.
Excellent. All right. Perfect. Okay. Next one is number 49, Vân Anh.
Yes, I'm here. I'm Vân Anh. Yeah.
All right. Do you know what is this kind of like chart showing?
Yeah, it shows the development of the baby through months. So the term is developmental milestone.
Excellent. It's developmental milestone, right? Excellent. Perfect. All right. I guess you can continue with the next one. Okay. Yeah, so people keep saying that pediatrics are fun and all smiley, but yeah, we see a lot of crying and screaming too. So can you match the term with the picture for me?
So number 1, I think that's the immunizations. That is when you give the vaccination for the baby.
Perfect. All right. So, how about this term?
Number 2, yeah. I think that is number 4. Picture number 4. Separation anxieties, when the baby have to say goodbye to mommy because she goes to school. Picture number 3, I think it's temper tantrum. This is the time when the baby has something in his emotion. And the last one is stranger anxiety, because maybe Santa Claus is someone strange and the baby dries to when he meets the stranger.
Excellent. Perfect. All right. So all of these conditions are very, very normal infant behavior. So nothing to be worried at all, but it's very, very disturbing for parents because the child can cry and whine for a very long period of time. Excellent. All right. Number 40, well, I think we are at 53. Tống Huy, can you read the first 4 terms for me?
Yeah, developmental
here.
milestones.
Oh, wait, I think it's number 50. Am I missing something? 52, right?
All right.
Oh, 53. Tống Huy, yep.
Right, so we get developmental milestones.
Excellent.
So next one is developmental delay.
Excellent. So before we move on to the next one, do you know what it means, developmental delay?
I mean, the condition of a child being less developed mentally or physically than is normal for it mean chậm phát triển in Vietnamese.
Mm-hmm. Yep. So anytime when you have a child that doesn't meet their developmental milestone is when we concern about developmental delay, right?
Yeah.
Excellent. All right, next term.
So the next one is toilet training.
Excellent. And the last one?
This one is temper tantrum.
Excellent. All right. And then we usually just call them, like, for short, we call them tantrum. So we if you're a pediatrician, you're gonna hear a lot of this word like around 1 or 2 year old. This is like the peak of tantrum for children. Like most of the visit will be like surround this word. And then for toilet training, we have a more commonly used term is potty training.
Yes.
Excellent. All right. And then number...
Sarah, I have a question about temper tantrum. Sometimes I heard about the 3 years old crisis. Yeah, and I want to ask you about, is it similar to temper tantrum or not?
So it's a little bit of both, right? So I think in at least in the US, we call them terrible two. So like usually like around 2 year old when like the child develop enough to have like, yep, that is the peak of temper tantrum. But also they are more well developed and then they can do more things and get into more trouble, right? They walk well, they can climb upstairs, they run well, they can take off their clothes. So usually that is like a combination of like both the tantrum and then normal developmental, that now there's a lot more things that they can do, that they can get themselves into. So that's why we kind of call like the terrible two. Does that make sense?
Yeah, okay. Thank you.
Yeah, I think tantrum is just an event, an incident, right? And the crisis is kind of like a period in this developmental stage, right? So
yeah, it's just like tantrum. It like one behavior that can make as part of the whole like terrible two crisis. It's like a symptom of it.
Crisis là cái giai đoạn, còn trong giai đoạn đó thì the kids tend to throw tantrum, tend to act, like bad kids.
Like toddler.
Okay, yeah.
All right. All right. Next one, number 56, Sung Tung. The last 3 words, please, for you.
The first word, stranger anxiety.
Right. So stranger anxiety.
Stranger anxiety.
So it's like the X here is actually pronounced similar to a Z. So anxiety.
Anxiety.
Yep, that's how good. All right, next word.
Separation anxiety.
Yep.
Immunization vaccine.
Excellent. Yep. Like you did the exact thing that you should do, right? Because like during your first attempt, you was trying to say it really fast, and then it kind of like make it harder, right? So whenever you feel like you struggle with the word, just slow down like you did, and it make the term a little bit easier to pronounce.
Yeah.
Perfect. All right. Okay. So we talk about vaccination. This is the thing that we vaccinate for. Okay. Number 58, Yang Pham. You can read the first 4 terms.
Is that right? Measles.
Yeah. Measles, excellent.
And number 2, rubella.
Yep, rubella.
Number 3, mumps.
Yep, mumps.
Mumps. The next one, varicella.
Excellent, perfect. Alrighty. Yep. So measles is the disease that's pretty common. Used to be pretty common, right? And I think I remember we had a pretty big outbreak in Vietnam a few years back too. So there's another term for measles, rubella, but we usually don't use them as much. Same for rubella. Sometimes they are called German measles. So those are the same disease. And then for varicella, the layperson term is chickenpox. Next one is number 59. Vâng Anh. Yep, pertussis tetanus. Yep, so scarlatina.
Scarlatina.
Yep.
Diphtheria.
So diphtheria.
Diphtheria.
Excellent.
Diphtheria.
Right. So yep. So pertussis have the other name is
whooping cough.
Yep, whooping cough. You know why they call it whooping cough?
But the cough is very long and I mean in từng đợt một ạ. Không biết giải thích.
Yeah. So so they call it whooping cough is because like, so yeah, you are correct. So the cough spell is really long, and because it's so long, the kid couldn't breathe. So at the end of the cough spell, they usually take in a very deep breath, and we call them a whoop. So it's like, so that is the whoop so that's why they call them whooping cough. It's very, very classic. All right. And scarlatina, the late term person term would be scarlet fever. Just because the kids have fever and then they have like kind of like diffuse red rash all over the body. All right. And then number 60, Vang Bao.
Poliomyelitis.
Yep, poliomyelitis. Can you like use the terminology here and kind of explain to me what is the disease?
Polis mean many.
Right. How about this term?
Myel is. No, I don't know. I don't understand myos. The itis
Okay.
is meaning inflammation.
Yep, excellent. Right. So a little bit of tricky in this term. So it's actually not poly, it's actually polio. So polio is the name of the virus that's causing the disease. You know the polio virus?
Yes.
Yep. So polio, they put it there just kind of telling you that this whole disease caused by the polio virus. You are correct. Itis is inflammation, and myelo. So right here, myelo is spine. Anything related to the spine. So inflammations of the spine caused by the polio virus. Does that make sense?
All right.
All right. Next term.
Pneumonia.
All right. So remember, there's no P here. This P is silent. So pneumonia.
Pneumonia.
Excellent. All right.
Meningitis.
All right. So meningitis.
Meningitis.
Excellent. All right. So what is meningitis?
Meningitis mean I remember it's something in the brain. itis inflammation and meninging.
Yep. So meninges is the layer that cover like immediately covering the brain, right? So meningitis is the inflammations of the layer that covering the brain.
Alright.
Right. So Việt Nam mình gọi là viêm màng não đúng không?
No. Em không nhớ tiếng meaning rồi.
And then next term.
Gastroenteritis.
All right. So what is gastroenteritis?
Gastro có nghĩa là stomach.
Gastro is stomach. Excellent.
And enteritis. Enter meaning intestine. Itis inflammation. It means inflammation of inflammation of intestine and stomach.
Excellent. Perfect. Yep. It's inflammation of the stomach and the intestine. Excellent. All right. How about the last word?
Hepatitis.
Hepatitis.
Hepa means liver.
So it's liver.
Livers and itis inflammation.
Yep. Yeah. So this word is pronounced liver.
Liver.
Yep. So hepatitis is the inflammations of the liver.
Okay. All right.
All right. Perfect.
Thank you.
Okay.
Sarah, I have a question about anti-vaccine. In Vietnam, anti-vaccine is rising problem. What about in US? As a pediatrician, how do you deal with anti-vaccine parents?
Yep, that is an excellent question. So we have quite a bit of those in the United States as well, because like this is the country of like freedom of choice, right? So parents can decide to do whatever they want to with their children. So we try to counsel them as much as we can. So we talk about the pros and cons of getting vaccines. We try to dispute the concern that they have. So usually like there's a couple of vaccines that usually people really scare off. So the MMR vaccines or the measles, mumps, rubella vaccines is the one that like most people scare off because of the concern for like autism. So we talk about those. And then just trying to kind of explore just to see why they are worried and kind of try to address them. But at the end of the day, it's the parent's choice. We usually ask them to sign an acknowledgement form, just to saying that they acknowledge the risk that they are taking on for not vaccinating their children. But that's all we can do. But yeah, excellent questions.
Yeah, okay, I got it. Thank you.
All right. Since it's kind of half time, why don't we take a quick break and then we can move on to the rest of the topic. Does that sound okay, Edmund?
Yeah, let's do it. And any questions? Open table. Anyone can ask questions right now.
Dr. Sarah, you can set the difference about pneumonia and bronchopneumonia because I confused about that. Some people use pneumonia and some people use bronchopneumonia. And when we see consolidation in chest X-ray, if we see all of blood of the lungs, we can set a lot pneumonia, but we only see the consolidation in not full of blood lung. We can talk blood pneumonia.
Yeah, so I think because you sound a little bit distant, but from what I heard is the question is what is the difference between lobar pneumonia and bronchopneumonia? Is that what I heard correctly?
The first is the difference of pneumonia and bronchopneumonia?
Okay, so there's actually no difference. So it's just an interchangeable term. So if you go into the very detail, you can say that pneumonia is the inflammation or infections of the lung tissues. And then bronchopneumonia is the infections of the lung tissues and the airway. But to be honest, the lung tissues usually include the big airway. So it's very hard for you just to have inflammations of just the small area of the lungs and not involving the big airway. So for me, those terms are used interchangeable. So pneumonia, bronchopneumonia, and I think most of the term in the US we just say pneumonia. I don't think we use the term bronchopneumonia that often. Does that answer your question?
The second question is about labral pneumonia. If we see in a chest X-ray, the white cloud in full label of left side or right side of lungs, we can say we can diagnose labral pneumonia, but we but we only see not full of label. We can set that in lab. We can diagnose. Tức là nếu mà mình nhìn thấy rõ tổn thương mờ hẳn một phần, ví dụ như hình tam giác ở phía giữa hay là ở phía dưới, thì mình có thể nói là viêm phổi thùy là labral pneumonia. Nhưng mà nếu mà chỉ nhìn thấy một phần nhỏ, nhưng tổn thương nó vẫn là đông đặc riêng về một phần nhỏ, nhưng không hẳn là hết cả cái thùy phổi đấy, mà thậm chí nếu mà muốn rõ được phân thùy nào thì phải chụp cắt lớp vi tính ạ. Thì lúc đấy mình sẽ nói là có được nói là viêm phổi thùy nó không có.
Thì mình đánh ra hai cái từ cho bạn á. Thì cái lobar pneumonia your definition is correct, is spot on, right? So lobar pneumonia is the inflammation infections of the entire lobe of the lungs, right? That's why we call them lobar pneumonia. And then when you have like scatter infections of different area of the lung that didn't involve the entire lobes, usually we call them atypical pneumonia. It sometimes you have like a spot here, a spot there. Sometimes it affects both lungs. We call them atypical pneumonia. Does that answer your questions?
Oh, thank you.
All right. Any other questions? This is a like we've been having like great questions, so keep them coming. I enjoy this a lot.
Cho hỏi xíu ha, cái bệnh rubella bên German measles có tên tiếng Việt là gì không?
Này chắc phải hỏi mấy bạn ha.
Tên tiếng Việt vẫn là rubella thầy ạ. Ở Việt Nam vẫn gọi là rubella thôi ạ.
Rubella. Nhưng mà ít gọi, nhưng mà sởi thì gọi là sởi thôi chứ đâu gọi là rubella.
Nhưng mà ở trong sách người ta ghi là bệnh sởi Đức với cả bệnh rubella, nhưng mà thường gặp nhất vẫn là bệnh rubella. Bệnh này bây giờ cũng ít gặp thôi ạ, vì có vaccine rồi ạ.
Lúc đầu là mình tính là không có để tính tiếng Việt, nhưng mà không có để tên tiếng Việt rồi không biết làm sao để diễn tả bệnh, nên thôi quyết định bỏ tên tiếng Việt vô.
Còn bên mình mà tiêm chủng thủy đậu là bây giờ là tiêm đại trà hết trơn chứ đâu có bắt buộc phải không? Thủy đậu là tiêm chủng bắt buộc phải không? Chickenpox.
Em không biết là có nằm trong chương trình tiêm chủng quốc gia hay không, nhưng mà vaccine thì
thủy đậu không phải là chương trình tiêm chủng quốc gia bắt buộc đâu ạ. Bắt buộc thì chỉ có tiêm lao ạ, viêm gan B sau sinh này, tiêm lao, bạch hầu, ho gà, uốn ván sau sinh, đấy là chương trình miễn phí. Còn ngoài ra bây giờ thì sẽ có thêm một số các chương trình mất phí thêm, và những cái bệnh đặc biệt thêm đấy, rồi viêm màng não, rồi thì trong cái bệnh bạch hầu, ho gà, uốn ván bại liệt, em nói thiếu ấy, cái bắt buộc có bốn cái chủng đấy, thì người ta thêm 2 tip nữa là thêm HI vào nữa, HI đấy, phế cầu. Nói chung là dạo này tiêm cũng nhiều với cả vaccine rota đấy. Còn nếu mà được miễn phí theo của nhà nước ấy thì chỉ có vài bệnh thôi: lao, viêm gan B, bạch hầu, ho gà, uốn ván, bại liệt.
Vậy là sởi với rubella với quai bị là tiêm là tự trả tiền.
Sởi lúc 9 tháng là cũng được miễn phí đấy. Còn nếu như mà muốn tiêm cái mở rộng hơn thì sởi, quai bị, rubella là tiêm MMA ấy, lúc 12 tháng, nhắc lại lúc 18 tháng.
Nhưng mà cái đó là trả tiền hay là nhà nước trả tiền? MMA là tự trả.
Nếu mà mình tiêm sởi thì mình sẽ được miễn phí lúc 9 tháng. Nhưng mà nếu mà mình muốn thêm cả quai bị này, rubella này sẽ mất tiền này. Các cái vaccine về viêm màng não mô cầu cũng mất tiền. Vaccine viêm gan A cũng mất tiền.
Bên Mỹ là tất cả những cái bệnh này là cover hết, là chính phủ trả tiền hết.
Bây giờ người lớn cũng tiêm varicella luôn. Ai mà thử test ra mà cái miễn dịch thấp cũng chích luôn. Varicella cho người lớn chích luôn. Chính phủ trả tiền luôn. Ủa vậy mình không có vậy bên Việt Nam mình không chích smallpox như là tuyệt chủng
mà người lớn thì ở Việt Nam ấy, chỉ hay chích cúm thôi, với cả là có thể với những cụ già ấy, thì sẽ chích thêm phế cầu, cúm và phế cầu ạ.
Bên này thì test chừng nào test không có miễn dịch của varicella mới chích cái varicella cho người lớn. Và mình là cái smallpox, cái thủy đậu là đâu còn chích nữa hả? Như là tuyệt chủng là không chích nữa hả?
Không chích nữa, bên Mỹ cũng đâu còn chích đâu.
Thủy đậu ở Việt Nam thỉnh thoảng người lớn vẫn gặp thầy ạ.
Không phải thủy đậu, smallpox chứ không phải là
đậu mùa cơ, mới
đậu mùa
mới hết, còn thủy đậu vẫn còn thầy ạ.
Thủy đậu còn, nhưng mà không có chích mở rộng không, chỉ đó thì ai muốn chích thì chích thôi.
Vâng, cái đấy thì phải phí dịch vụ ạ, phải tiêm dịch vụ ạ.
Rồi có nhiều cái học.
Em ơi thầy cho bạn số 12 vào á, bạn nam á.
Bạn ra các bạn đổi tên nên không biết bạn này. Bạn nam vô nhớ đổi tên lại. Rồi nam vô đổi tên có số lại nha, để cái gì gọi như vậy.
Rồi, mọi người nghỉ ngơi đủ chưa? Mình tiếp tục ha.
Tiếp tục nha.
Alright. Oops, don't need that. Move on. Alright. The next topic is like the most common complaint that like you ever will have as a pediatrician. So let me make sure I clean up those annotations. There we go. Alrighty. I think I was at number 60 or 61. I can't remember. I think
the next is 61.
61. Okay, perfect. Thank you. Thái Thọ. Right. Thọ, can you unmute and read the first three, please? All right, I guess we're just gonna move on to number 62, Nam Phương.
Yeah. URI, upper respiratory tract infection.
Oops. Yep, you read it correctly. I just realized that I actually did a typo, and I was like, oops, that looks weird. Let me making sure I correct it so it doesn't look very weird. Yeah, like that looked very weird. Okay, ignore that part.
Yeah, upper respiratory tract infection.
Excellent, thank you. Perfect.
The next is influenza.
Yep.
Pharyngitis.
Yep. Pharyngitis. So it's like
pharyngitis. Yeah. Pharyngitis. Otitis media.
Excellent.
Otitis media.
Otitis media. All right, and then this is kind of, I think we learned about this term during our last lecture together. So this is like kind of the common name that we call them. So URI, we usually call them common cold. So it's just like the regular cold that everyone has. And then influenza, we just call them flu. For pharyngitis, Nam-Phuong, can you pronounce the name of the bacteria advanced level?
Streptococcus pyogenes.
Right,
Pyogen.
Yep, pyogenes.
Pyogenes. Yeah.
Yep. So this is actually a Latin name, right? So we pronounce every word. So pyogenes.
Yeah. And the first word, streptococcus.
Yep, that is perfect. Yep, Streptococcus pyogenes.
Yeah, Streptococcus pyogenes. Genus.
Excellent. Yep. Yeah, and then so because those words are just too much of a mouthful, so we usually just call them group A strep. So this is the thing that you will hear quite a bit if you're a pediatrician. So this is a common bacteria that causes sore throat in babies, in children. All right, moving on. Number 68, Hồng Nguyên. Can you read the next 4 terms, please?
I am here. Otitis media. Bronchiolitis.
All right, so the CH in most medical terms is usually pronounced as a K. So bronchiolitis.
Bronchiolitis.
Excellent.
Laryngo. Cái từ này dài quá cô ạ.
Yep,
tập từ nãy giờ chưa xong.
That is okay. Let's break them down together so it make it a little bit easier to pronounce, right? So laryngo, tracheo, bronchitis. Right, now put them together. Laryngo, tracheo, bronchitis.
Laryngo, bronchitis.
Right, so remember CH is pronounced as K. So laryngo, tracheo, bronchitis.
Laryngo, tracheo, bronchitis.
Bronchitis.
All
right, excellent. One more go. Almost there.
Laryngo, tracheo, bronchitis.
Making sure this is too big. So I feel like you kind of struggle a little bit with the K, right? So it's all of the CH are pronounced as K. All right, so tracheo, right there, bronchitis. All right, now try again. Hopefully the reminder is enough.
Laryngo, tracheo.
There's an E there. So tracheo.
Bronchitis.
Excellent. All right. Now, can you try it just a little bit quicker?
Laryngo, tracheo, bronchitis.
All right. Cool. All right. So this is, it sounds like going to be your homework for today, right? Pronounce this word 10 times tonight before going to bed.
Dạ, mấy em để ý nha, như chữ CH nó chữ đọc là K á, giống như là chemist đó, mấy chữ thông thường mình để ý đó thì mình áp dụng như thế này, như là hóa là chemist, thì nó đọc là chữ K chứ không phải đọc chữ chợ, cho nên tiếng Anh nó phức tạp chút xíu. Nhưng quen từ quen thôi, không sao hết. Đến đây đọc K. Laryngo, tracheo, bronchitis. Cứ từ từ không gấp, nhưng mình biết mấy gốc từ rồi á thì mình cứ break down nó ra thì đọc được hết à, chứ không gì phải lo. Rồi về nhà đọc tiếp.
Yep. And then that's like, and then believe me, like even like American doctor have issue with trying to say this word, so we actually never really use this word. We call them group. So this is the word we would use, group. This is the kind of common name of this condition. Can you say that word for me? Is it what number are we at? And when I kind of lost track, I don't think he kind of like get off my list for some reason.
That's 68 luôn. Em mới đọc không?
68.
Dạ
Yeah.
vâng, em mới đọc.
Yeah. Nguyên, can you say this word for me?
Group.
So it's group.
Group.
Excellent. Perfect. Yep. So it's a good idea to practice this term because it's actually like kind of get you used to things, but this is the word that we use for this condition, group. All right, I think you have 2 more words.
Này em cũng không rõ.
It's pneumonia. Can you say the word for me, Nguyên? Pneumonia.
Pneumonia.
Excellent. All right, so what is pneumonia?
Đây là infection of the lung tissue.
Excellent, right? Viêm phổi, right? All right, and then last word?
Meningitis.
Right, meningitis. All right, you know what it means? What does it mean?
Inflammation of the meninges.
Like meninges.
Meninges.
Yep. So it's the inflammation of the meninges, or the innermost layer of the skull that immediately covering the brain and the spine. Tiếng Việt mình gọi là viêm màng não.
Vâng, viêm màng não.
Excellent. All right, thank you. Great effort. All right, and then I think the next one is 69. Hương Thu.
I'm here.
Okay, I'm here. I'm 69.
Yep. Okay, go ahead.
Yeah. Okay. Pneumonia.
All right. So I think we are right here.
Oh, sorry. I'm sorry. Sepsis.
You know what sepsis is?
Yeah, it's kind of infection caused by the presence of bacteria or virus in the bloodstream.
Yep, excellent. This is the nightmare of a pediatrician.
Yeah, okay. And urinary tract infection.
Excellent. All right, and then sometimes we call them UTI. It's like the short form for it. All right, next word.
Pyelonephritis.
So pyelonephritis.
Pyelonephritis.
Excellent. All right. Can you break down the word for me? You know what it means?
Yeah, pyelo mean like kidney, kind of something related to kidney. Nephro also related to kidney or urinary tract. Or itis means inflammation. So the whole word means inflammation of the kidney and urinary tract.
Excellent. All right. So just a little bit corrections. Let me making sure I have it correctly. Yeah. So pyelonephritis. So pyelo mean like the urinary tract, or it stems from the word pelvic of the kidney. Because like for those who remember, there's a kidney, you have like a bunch of like nephron, and then you have like all of them go into a collecting duct, like collecting system, and then that area right there is called the pelvic. So that is the term that we're saying. The Latin term for it is pyelo. So pyelo is the inflammation of that pelvic area. And then nephro is the kidney itself, so the tissue, the kidney tissue itself. and then itis is inflammation. So pyelonephritis is inflammations of the kidney and the collecting duct. Does that make sense?
Yeah.
Excellent. All right. And then last word?
Gastroenteritis.
All right. So what does that mean?
That means the inflammation of the gastrointestinal tract.
All right. So what is gastro?
Gastro means stomach, and entero means intestine, and itis refer to inflammation.
Perfect. All right. And we usually just call them stomach bug. So if you hear anyone that's like, oh my God, I have a stomach bug, that is mean that they have gastroenteritis. All right, perfect. Thank you.
Yeah, thank you.
All right. And then clear out something. And then I think we are at 70, Hoàng Bình.
Yes, I'm here.
Perfect. Can you pronounce the first word for me?
Enuresis.
Yep, enuresis.
Encopresis.
Yep, encopresis. Excellent. All right. So this word is a little bit hard. I think there's a lot of things that you guys have not learned before. So I kind of break down the first word for you. So en in here is mean inside of something. You are like, or is you like urine, and then ss is the action or process. So the whole word means urinating inside something, so inside clothing usually. So in English, like we usually the common term for them is that wedding. So this is what we call them in regular English. In Vietnamese, it's like tiểu dầm, đá dầm, đúng không? All right. So, but can you use that kind of logic up there and then tell me what does this word mean? Encopresis mean?
The first en mean in something. And co, maybe I think copro is mean stone.
Excellent.
And acid is action or process. It means the baby make a stone inside something. And I think that means it do.
Yep, excellent, perfect. So it's mean that, right? So in regular English, we will say that the baby is soiling. All right, so this is the term. If like parents tell you that the child keeps soiling their clothing, this means that they have encopresis. Excellent, thank you. All right, moving on. Okay. And then next one is number 72.
Yeah, I'm here.
All right. So what do you think this picture is trying to tell you? What condition is it? All right. Do you know what ADHD is?
ADHD stands for Attention Deficit Hyperactive Disorder.
Yep. Excellent. So hyperactive disorder. Perfect. All right. So this is kind of just the symptom of that, right?
Yeah.
So the kid is very easily distracted, inattentive, like hyperactive, very impulsive. Excellent. All right. And then do you know what this condition is? The picture on the right.
This picture describes learning disability.
Yep. So this is a specific condition that is a part of the learning disability disorders. So this is a handwriting of a child with dyslexia.
Or dyslexia.
Yep. All right. So yeah, so you will see that a lot of children who have dyslexia, they have mirror image writing. So they kind of like all of their like writing is kind of like you have to like put a mirror for it to like be correct, to be able to read it. All right, so can you say the word again?
Dyslexia.
Yep, dyslexia. And then how about this term?
Attention deficit hyperactivity disorder.
Excellent. All right, and then so it's quite a mouthful, so we usually just call them ADHD. All right. So it's getting quite common conditions in school-age children. All right, thank you. All right, let's see, number 17, Phương Thảo. Can you read the first four terms for me? All right, 79, Vũ Phương Thảo.
Enuresis.
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 E. All right, next one.
Can you hear me?
Yep, we can hear you. Go ahead. All right, I think we actually just lost you. Okay, perfect. We can hear you. Okay, you kind of cutting in and out a bit, but try again.
Encopresis.
So encopresis.
Encopresis.
Excellent.
Okay. Constipation.
Yep, constipations.
Pediculosis.
Yep, pediculosis. You know what pediculosis is?
Trong tiếng Việt như là nhiễm cháy rặn.
Yep. So in English, we call that little insect is lice. So lice infestations is pediculosis. All right, excellent, thank you. And then next one is number 83, word jump.
Okay, the next one is attention deficit hyperactive disorder. The next one, learning disability. And the last one is dyslexia.
Excellent. Yep. Can you do you know of any other learning disabilities besides dyslexia?
I don't think it has the relationship between these disorders.
Yep. So actually, dyslexia is a part of a learning disability, right? So a child with dyslexia can also be classified as having this learning disability, but other condition is like struggling with math, struggling with writing. Yeah. It's also called learning disability. So sometimes these children get confused with having low IQ just because they are not doing well in school. Just like most of them are usually have normal intellectual. It's just they struggle with the traditional classroom setting.
Yeah, thank you for your information.
Yep. All right, next one is 85, Thanh Hải. All right, do you know what is this picture describe?
I see many picture image in this, but I don't know detail about this. About what about?
Right. How about like do you know what the term that we are looking for in Vietnamese? What do you think the picture are trying to tell us?
Tuổi hiểu thầy ạ.
Dậy thì ạ. Cái này là tuổi dậy thì ạ.
Excellent. All right. So dậy thì in English is puberty. Like the word is right there.
Yes, puberty.
Excellent, puberty. Perfect. All right. Can you read this word for me?
Menstrual cycle.
Yep, menstrual cycle. Right. Do you know what that is?
It's này là tử cung ạ.
So tử cung is uterus, right? So this describing the organ itself. Menstrual cycle is something different.
Cái này là
All right,
chu kỳ kinh nguyệt.
Perfect, excellent. Right, just the cycle mean something go around, like repeating, right? And then menstrual is just the process of shedding, changing of the uterus lining. Perfect. All right. And next one is number 89, Bùi Thị Thanh Tuyền. All right, can you read the two terms and then kind of try to figure out what is the difference between the two terms? Thanh Tuyền, can you hear us?
Yes, I'm here.
Excellent. All right. So read the two terms first, and then try to kind of like differentiate between the two for me.
Amino are here, and this amino are here.
All right. So this is a little tricky. So that little H there is usually silent. So it's amenorrhea.
Amenorrhea.
Yep. And then this. Yep. And then dysmenorrhea.
Dysmenorrhea.
Yep. Excellent. All right. Can you kind of like just think about what we learned before and then kind of try to like differentiate between the two terms for me? So what do you think amenorrhea is? All right. So what is anemia? You guys learned this term before. What is anemia?
Anemia.
All right. Anyone want to help your friend out?
So I think that amenorrhea is rhea like something running or like diarrhea. A is for no or absent or missing. So amenorrhea is mean the absence of menstruation.
Excellent.
And this like a dysfunction. Yeah. So it's
yep. So it's a little tricky, right? So the first word is absolutely correct. So menorrhea, so the word down here, it means that it is a normal menstrual cycle. So this is normal. Amenorrhea is mean that you don't have like menstruations at all. And then this word is similar to this term. Anyone remember what this term is? Dyspnea. So difficulty breathing or sometimes painful breathing. So this menorrhea is actually painful menstruations. All right. Questions? All right, let's moving on.
Em hỏi cô một chút là vậy thì cái từ mà rối loạn kinh nguyệt ấy thì nó sẽ là cái từ gì ạ?
Usually we just call them like irregular menstruation. So I'll write it down for you guys. So irregular menstruation. So irregular, I mean that it's not on the right schedule. So it's like it can be every 1 week, every 2 months, every 3 months, every 1 month. It's not predictable. So we call them irregular. All right, good questions. Perfect. All right, any more questions before we move on? All right, I think we are at number 91. Phang Thị Lưu.
Yes.
Right, can you read the 4 terms for us?
Yeah. Puberty.
Excellent.
Menstruation. Amenorrhea. Dysmenorrhea.
Dysmenorrhea. Excellent. Thank you. All right. And then number, I think we finished. Anman, do we know that? I think we have a couple that didn't answer. Do you remember which one was that?
Number 10 still there?
I don't think number 10 is here anymore. So
22.
What? 22. Lê Thanh Tú. Tú, are you with us?
Yeah, but seems like he or she is not listening in.
Okay.
Mấy bạn vào sau, anyone, you can raise your hands if you haven't been going on yet. 85, you talk already, right? Anyone haven't talked yet? All right, we can start from the beginning again.
All right, so we're just gonna start from the beginning, just since we have time limited. So number 1, Ngọc, do you want to read this word for me?
Contraceptive method.
Excellent. So do you know what it is?
Mean tiếng Việt là các phương pháp tránh thai ạ.
So like different ways to prevent pregnancy, right? So that means what contraceptive means. Contra mean against. Septive mean the receptions of the eggs and the sperm into the in the uterus. Excellent. So there's a lot of them. We're not going to go through all of them, but we can read a little bit about them. All right. Why don't you read the first 3 for me, Ngọc?
Oral contraception.
Right. You want to start from the beginning for me?
Yes. Contraception.
Excellent.
Condom. Oral contraception.
Excellent. All right. So which one of down here is condom? Nice. So which row has condom in it? Which row does like condom belong to? It's right here, right? There we go. We have external condom and internal condom. It's right there. All right. So it's actually not that great. It's good, but it's not perfect. All right. Okay. Number 6, Minh Tùng.
Yes. Condom and oral contraception.
Oral contraception. So what is oral contraception?
It means when you use pin for the contraction, it is about the hormonal medication, tức là thuốc tránh thai.
Okay, and then this is an advanced questions. It's okay if you don't know. You can ask your friend to help you out too. Do you know what is OCP, mini pills, and morning after pill is?
OCP. I think O is mean oral. C. I cannot, but I think P is the pregnation. C, I don't know exactly what is this.
So you are close. So O is oral. C means combine.
Combine.
And then P means pill. So oral combined pills. It means that it has both estrogen and progesterone in it. So that this is what it say.
Sorry. C in combine it with me. I mean with ED or just the combine.
Right here. All right. So this is what OCP is. So combined, there's a D in it. All right.
Okay, thank you.
Okay, and then does anyone know what mini is? All right, so this is a little hard, right? So mini pills is the layman term for progestin only pill. And then morning after pill is for emergency. All right. So these two are the regular one that you take, that you have to take every day to prevent pregnancy. The morning after pill is just like the name it said. It used the morning after you have sex to prevent pregnancy after. So excellent. Okay, next one is, I think, is number 7, Nga đổ. Can you read the last 2 terms for me? Yeah, can you hear us? All right, we're just gonna move on to number 12. As in it's Thành Nam.
In here, but not in here. Let's keep moving on. 14.
All right, 14, Hoàng Lan. Hoàng Lan, can you hear us? All righty, moving on. Number 15, Ngọc Ánh. Oh, I see there's a Nhung Lê. Ánh, can you hold on 1 second? Nhung Lê, do you have questions?
No, no. I want to pronounce this word, but
okay. So why don't we let Ánh try first, and then it's your turn. Is that sound good?
Okay, that is a birth control implant.
So control. So the stress is on the second. So control.
Control.
Excellent.
Birth control implant.
Yep, implant. Excellent. All right. And then what's the last word?
Intrauterine device.
So intrauterine device.
Intrauterine device.
Excellent. All right. See if you can find those in here. Where's the implant?
Implant is contraceptive injection, right?
So it's actually up here. So that little white like thing is the implant. All right, and then where's the IUD or the intrauterine device?
Number 2, the second device.
Yep. So both of these, both of these are IUD. So intrauterine device, or we call it short IUD. They can have different types. So all of these three are pretty reliable. Excellent. All right. And then Nhung Le, since you volunteer, you want to give it a try, give it a go?
Yes, I want to pronounce this word, oral contraception.
Excellent.
Birth
Oral
control
contraception.
implant. Birth control implant. Intrauterine device.
All right, so intrauterine device.
Intrauterine device.
Excellent. Great. Great job.
Yes, thank you.
All right. Next one is Thanh Learn. All right, let me clear things out a bit.
Yeah.
There's a lot of words in here. I'm not gonna make you pronounce all of them, but do you know what this picture trying to tell us?
Yeah. So sorry, teacher. Can you repeat the question?
So this kind of word, clowns, have a lot of conditions, and it's all pointing to a group of diseases. Do you know what the group of disease is?
Yeah, I know. Sexual transmitted disease.
Excellent. Great job. All right. So you already pronounced the first one. How about trying to pronounce the first three?
Gonorrhea.
Excellent.
Chlamydia.
Excellent.
Syphilis.
Yep, syphilis.
Human papilloma virus.
Right, so papilloma.
Papilloma.
Excellent.
Virus.
All right. Do you want to try to pronounce the name of the bacteria? Give it a try. It's always fun.
Sorry?
You want to try to pronounce the name of the bacteria? So all of these caused by different kind of bacteria, right? So this is the name of it. You want to give it a try?
Neisseria gonorrhea.
Excellent.
Chlamydia. Trachomatis.
Trachomatis. Excellent.
Trachomatis.
All right. Last one.
Treponema. Pallidum.
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 Excellent. Treponema pallidum. All right. Great job. Like all of these words are pretty complicated, but you did a great job.
Thank you.
All right. And then number 36, Như Ngọc. You want to pronounce the three viruses?
Okay. Human papillomavirus. Herpes simplex virus.
Herpes.
Herpes
simplex. Yep.
Virus. Human immunodeficiency virus.
Yep. Alrighty. So what does human papilloma virus cause?
Em cũng chỉ biết là sụt màu gà thôi, cũng không biết là diễn tả theo tiếng Anh là gì.
Yep. Yeah, so it caused like the wart, right? So genital warts, and then it I don't know if you guys probably don't know that word, so I'll write it down for you guys. So genital warts. All right, and it's also caused cervical cancer, right? Ung thư cổ tử cung, đúng không? All right. And then, so this is a short term, we call them HPV, because all of these virus is pretty mouthful to say. So we, for papilloma virus, we call them HPV. For herpes simplex, we call them HSV. And then human immunodeficiency virus is HIV. All right. Bonus point for anyone who can give me the acronym for AIDS. What does AIDS stand for? All right. All right. You guys feel free to unmute yourself, you know it. If not, I can type it out for you. All right.
Acquired.
Yeah, I'm just typing it out.
No, the first not acute, but acquired.
Oh, yes, that is true. There we go. I can actually type them. Perfect. All right. Perfect. Any questions so far? We're almost done. All right, let's clear things out before we move on. All right, so this one is pretty complicated and I don't really expect you guys to know most of them, but it's kind of good to kind of practice like saying the term at least once. So Nguyễn Thị Dung, number 40. Why don't you give you try it out the first 4 terms?
Depression.
Suicide.
Suicide.
Excellent.
Panic attack.
Yep, panic attack.
Panic attack. Psychosis.
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 Excellent. All right, great. And next one is number 41. Hoài Thu. The next 4, please.
Substance abuse.
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 So stressing on the second one. Abuse.
Abuse.
Excellent. All right.
Yes.
Next one.
Illicit drugs.
So it's illicit. So it's actually pronounced as E. So illicit drugs.
Illicit drugs.
Excellent. Right.
I think it's the recreational drugs.
Right. So recreational drugs.
Recreational drugs.
Yep, that's great. And then the last word.
Vaping.
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 Excellent. All right. And then the last 4 term, Nguyễn Thị Thanh Hiền, number 46. Thanh Hiền.
Okay.
All right.
I'm sorry because I have some problem, so I cannot to open the video.
Okay, it's okay. Can you say the word for us?
So anorexia nervosa.
Yep. So anorexia nervosa.
Anorexia nervosa.
Excellent. All right. Next time.
Bulimia nervosa.
Excellent.
Gender dysphoria.
Yep. Gender dysphoria.
Gender dysphonia.
Dysphoria. Yep. And then last one.
And then the last one is body dysmorphia.
Excellent. Perfect. All right. And now this is questions for the rest of the group. Among these conditions, which one do you think has the highest risk for death? What is the most dangerous mental illness in this group?
Depression.
I got 1 vote for depression.
I think substance abuse.
I have 1 vote for substance abuse. Anyone else have any other thoughts? So it might surprise you. So the most dangerous mental health illness in adolescents or teenagers is actually these 2 diseases. So this together, we call them eating disorder. Eating disorders. So these are the deadliest mental illness in adolescents. Because they usually starve themselves to death. So that is pretty dangerous. All right. So the biggest difference between these 2 is that anorexia is usually they just withhold from eating altogether, and then bulimia is when they eat a lot and then kind of like make themselves vomit. So we call them binge and then purge. All right.
So can you explain more about the second word, nervosa?
Nervosa, it just means like something related to the nerve. It's a very old term. It just means that like it's a mental disorder kind of thing.
Thank you.
Excuse me, I have a question.
Mm-hmm.
Mental disorder and or mental illness include the psychiatric disease or psychological disease, right?
Mm-hmm. Yeah, so it's actually kind of synonym. So psychological disorder or psychiatric conditions or mental illness are kind of sometimes used interchangeably. So we kind of treat all 3 of them kind of similar. Does that make sense?
Yeah. Okay, thank you.
All right. And then I think that is all I have for today, I believe. If anyone have noticed that some of the slides have this little icon in the corner. So this is my cheat way just to tell you guys that some of the words that's gonna be on the slide that have that icon will be on the test. I'll send out the slide later so that you guys have the highlight for the slide, but that kind of like just I guess like in Vietnam it's like đề cương, right? So it's kind of marked to remind you which one gonna comes up in the test, so that you guys don't have to learn a lot of terms. Alrighty, any other questions?
Thank you so much.
Có trọng tâm trọng điểm ha, có đề cương. Thì thầy Dinh-Van cũng nhắn là phần thi cũng gần tới rồi ha, còn mấy bữa nữa là tới thi cuối khóa, thì cứ học đi, cũng sẽ cho những cái từ cũng tương đối thông thường, cho nên là không muốn mấy em nào sâu học cái từ nào bí hiểm không ai xài tới thì cũng không có cần thiết, cho nên từ nào thông thường thì sẽ ưu tiên. Nhưng mà chắc cũng có một vài từ nó có khó hơn chút xíu để còn biết người nào giỏi hơn người nào dở hơn, nhưng mà đừng có lo quá ha, cứ thấy những từ nào tương đối phổ biến trong tiếng Việt thì nó cũng phổ biến trong tiếng Anh vậy thôi, cũng đơn giản lắm, chứ đừng có tìm cái từ nào thiệt là cao siêu học xong rồi không ai xài hết thì cũng mất công mình. Rồi tập đọc, quan trọng là mấy cái phát âm, mấy cái trọng âm cho nó đúng. Trước nhất là cái trọng âm mà sai thì đọc cái từ nó ra đúng, đọc cũng nghe cũng hiểu như vừa child, China mà đọc China cái là không ai hiểu gì hết trơn. cho nên là cứ nhắc quay trọng âm rồi coi mấy cái từ nhiều từ tiếng Anh đúng là không khó có quy luật như chữ chơi ha, vừa China, nhưng ở chỗ khác chữ chờ đó là chữ G thì mình chỉ đọc quen rồi từ từ mình thấy ra thôi. Rồi như mấy chữ CH là đọc chữ K chứ không phải là đọc chữ chờ, thì để ý mấy cái đó thì cũng không sao, cứ từ từ không gì gấp, nhưng mà phải chịu khó từ từ. Rồi có ai hỏi thăm gì không? Hình như có ai nói đề nào khó quá hả?
Thế bài test cuối cùng thì là có bao nhiêu câu ạ?
Em muốn bao nhiêu câu với em là gì vậy? Tính lần trước bao nhiêu câu ha? Lần trước là 30 hay là 40 câu gì phải không?
Các cái bài midterm thì bọn em có 25 câu thôi.
25 câu hả? Thì có người nói 25 câu cứ gọi 50 câu kìa.
Tết cuối mới 50 mà midterm 25.
Thì cái đó thì để thầy Dinh-Van thầy cho đáp án cuối cùng là bao nhiêu câu, nhưng mà 50 câu cũng được ha, 25 câu làm được rồi thì cuối cùng là 50 câu, như là hồi trước làm bài tập 15 phút rồi giữa giờ rồi bài tập 45 phút gì đó, thế đó mình học phổ thông vậy đó.
Một tiết thi học kỳ.
Học kỳ tới 2 tiếng 3 tiếng này. Nhưng mà không lo, ai biết thì làm được thôi, còn không quá lo đâu, đừng lo. Thường là tới mấy em có quyết tâm theo đuổi tới bây giờ rồi thì cũng thu thập được một số phần, vì nó cũng lặp đi lặp lại một số cái, đừng có sợ quá.
Dạ, với lại mọi người ví dụ như là có cái gì đó thắc mắc hay là ngay cả những bài trước nữa thì cứ đăng lên hỏi rồi mọi người giải đáp. Hôm nay là rất là cảm ơn mọi người đặt rất là nhiều câu hỏi, lớp nó thú vị hơn.
Cũng học được cũng học được mấy bạn.
Em học được một mớ từ tiếng Việt.
Học được cái khóc dạ đề không, trước giờ không biết, không nghe luôn. Rồi cho nên là mình học lẫn nhau, đừng có ngại. Rồi còn ai hỏi thăm gì nữa không thì mình nghỉ ăn chơi cuối tuần.
Cảm ơn thầy với cô Sarah nhiều ạ.
Thôi cuối tuần vui vẻ ha, hẹn gặp lại tuần sau. Rồi bye bye mọi người nha.
Chào thầy ạ.
Rồi, dạ vào.